Welcome to the Deep Dive. Today, we're zeroing in on a really challenging public health issue, the rapid concerning rise of HIV in the Philippines.
Yeah, it's definitely demanding attention.
We're diving into the source material you shared with us to, really get a grip on what's happening over there. A nation of over 109 million people. And this isn't just another statistic, right? It feels like a dynamic, accelerating situation. Many are calling it a full-blown crisis.
They are, and the sources really underscore that. It's complex, and the scale, it's significant.
So our mission today, let's try to unpackage these striking numbers, figure out the complex web of factors driving this trend, and look at the efforts underway to push back.
Absolutely. Understanding how all those pieces fit together is, well, it's vital.
Okay, let's jump right into what the numbers are telling us from these sources because, wow, they paint a pretty stark picture.
They really do.
The Department of Health data shows 6,703 new infections reported just between January and April of 2025.
Just 4 months.
Exactly. And that's a 44% increase compared to the same time last year. 44%.
And if you look at some of the daily reports mentioned, like on X, that breaks down to an average of 57 new cases every single day.
57 a day. That's hard to grasp.
What's truly alarming, though, is the longer trend. The sources point to a more than 500% spike in cases since 2010.
A 500% spike. Since
Yeah.
2010, that number is just staggering, especially when you think globally HIV infections have been declining, right?
Right. UNAIDS data confirms that. But the Philippines, a 543% rise between 2010 and 2023. It's made it the absolute epicenter of the fastest growing HIV epidemic in the whole Western Pacific region.
The epicenter, that's a heavy label.
And it doesn't look like it's slowing down. The projections, based on how things are going now, suggest the total number of people living with HIV, PLHIV, could hit over 407,700 by 2030 if things don't change.
407,700. And where are we now?
As of April 2025, the total was 150,433. So that projection, it's a huge jump.
So who is being hit hardest by this? The sources really highlight one group in particular.
Young people.
Yeah, young people. Nearly half of those new infections we mentioned from early 2025 are among individuals aged 15 to 25.
15 to 25, that's a critical age group.
And the youngest case noted in the sources, a 12-year-old in Palawan. It brings home how urgent protecting youth really is.
It does. And adding another layer here, the data consistently shows that men who have sex with men, or MSM, are disproportionately affected. They account for, over 80% of reported cases?
Over 80%. And geographically, is it spread out or concentrated?
It's more concentrated. The dense urban areas, especially Metro Manila, they definitely bear the highest burden of infections.
Okay, and here's something else the sources emphasize, and it sounds really critical. Late diagnoses.
This is a major problem.
1 in 3 people living with HIV are diagnosed only when the virus has already progressed to an advanced stage.
Yeah, and that has direct, tragic consequences. It correlates directly with the number of AIDS-related deaths. That was 1,700 deaths in 2023 alone. So it highlights that the challenge isn't just preventing new infections, which is huge in itself, but also getting people tested early and treated early.
Right, because delayed diagnosis means delayed treatment.
Exactly. Delayed access to that life-saving antiretroviral therapy, the RT medication that keeps the virus under control. And it also means, missed opportunities to prevent further transmission.
These are real lives at risk, not just numbers. And it sounds like a health system under immense strain.
Absolutely.
It really makes you ask, how did we get here? How did a country that, once had relatively low rates become this epicenter of growth?
That's the core question, isn't it?
The sources dive into this, pointing to what they describe as a tangled web of interconnected factors driving these numbers.
And unpacking that why is so crucial. It really reveals the depth of the systemic issues, the societal problems contributing to this crisis.
Okay, factor number 1. This comes up again and again in the sources. It's the heavy burden of societal stigma.
Huge factor. Still.
This fear of judgment, often rooted in sort of cultural attitudes equating HIV with immorality.
Yeah.
Massive deterrent, right?
Absolutely. It stops people dead in their tracks from seeking testing, from seeking support.
And the consequence. The sources estimate nearly 40% of people living with HIV remain undiagnosed. Almost half.
40%.
Huh.
And hand in hand with that stigma is just a significant lack of awareness, basic awareness.
You mean people just don't know about HIV?
Well, a 2021 UP study mentioned in the sources found only 76% of young people aged 15 to 24 had even heard of HIV/AIDS.
Only 76%. That sounds low.
It's a really sharp drop from 95% back in 1994. This information gap, it leaves young people vulnerable to really dangerous myths.
Like what kind of myths?
Like the misconception that HIV can spread just through sharing food or casual contact. Things we know aren't true, but the myths persist.
Okay, so stigma, lack of awareness. What else? Access to healthcare must be a factor too, right?
Definitely. Especially outside the big cities, the DOH, the Department of Health, has 95 treatment hubs, which sounds like a lot. But the sources note most are in urban centers, so if you're in a rural area, it's tough.
And COVID must have impacted things too.
It did. Testing and treatment initiation rates dropped initially during the pandemic. They've recovered somewhat, but still, only 64% of PLHIV were actually on RT as of March 2024.
Only 64%. That leaves a huge treatment gap.
A very significant gap, meaning many aren't getting the treatment they need to stay healthy and prevent transmission.
Then there are economic pressures. Poverty comes up in the sources.
Yes, it exacerbates vulnerability. Poverty, which affected about 16% of the population in 2024, can unfortunately push individuals into survival sex work or other exploitative situations.
Which increases their risk of exposure.
Significantly, when the minimum wage often doesn't even cover basic living costs, economic hardship becomes a direct health risk.
And then there's the whole aspect of changing sexual behaviors, especially among young people.
Right. The sources talk about the young mobile population and the role of technology, online dating apps, Granger is mentioned specifically, and other social media platforms.
Facilitating casual encounters.
Exactly. And often unprotected sex. There's a striking stat from a 2017 survey. It noted just how low consistent condom use is.
How low?
Only 2% of married women and 3% of sexually active unmarried women reported using condoms consistently, 2 or 3%.
Wow. That's incredibly low.
It is. And finally, there's inadequate sex education in schools.
Ah, the cultural sensitivities issue.
Precisely. Comprehensive programs often face resistance, preventing youth from getting accurate, crucial information about prevention, about condoms, about pre-RP.
Pre-P being pre-exposure prophylaxis.
Yeah.
That daily pill.
Right. The pill that can significantly reduce the risk of getting HIV for people at high risk, but if you don't know about it or how to get it.
So let me see if I've got this. You layer stigma, lack of awareness, limited healthcare access, economic vulnerability, changing behaviors with tech, and insufficient education.
You really do get what the sources describe as a perfect storm. Each factor makes the others worse. It creates this incredibly challenging environment for actually preventing and controlling the spread.
Let's drill down a bit more on those societal and cultural layers, because the forces really hammer home that stigma isn't just like a social inconvenience. It's a direct health barrier.
It absolutely is, and the sources give concrete examples of its impact.
Like what?
People living with HIV reporting being gossiped about, being rejected by friends, by family sometimes, facing discrimination at work or in their communities.
That sounds awful.
There was a 2019 index cited. It showed 1 in 5 people from key populations had experienced discrimination just in the past year. 1 in 5.
And that fear of being judged, it has real consequences for it, right?
Tangible consequences. It directly delays people getting tested. It makes them afraid to disclose their status, even to partners sometimes, which means they often only seek care when they're already quite sick in the later stages of infection.
And those misconceptions we mentioned about casual contact, they fuel the fear.
They absolutely feel it, and they persist because public education often hasn't been consistent or widespread enough to counter them effectively.
Culturally, too, it seems like discussing sex and sexual health is still really difficult.
Very challenging, especially in a predominantly Catholic society where these topics can still feel taboo. This sensitivity, it hinders open discussion, and it definitely prevents schools from implementing truly comprehensive sex ed that includes frank talk about condoms and other prevention methods.
And add to that the geography. You mentioned over 7,000 islands.
Yeah, the geography of the Philippines creates huge disparities in healthcare access. Many remote areas just lack basic medical facilities. Forget specialized HIV care. Sometimes even basic testing isn't available.
So even if someone suspects they're at risk,
The cost, the difficulty of traveling to an urban center with a treatment hub, it can be a massive deterrent. especially if you're poor or live far away.
Is the government trying to decentralize services?
They are. The DOH is working on it, but the sources note that progress has been slow. It's a big logistical challenge.
And we keep circling back to economic hardship.
Because it's intrinsically linked, 16% below the poverty line. Youth unemployment at 7.5% for 15 to 24-year-olds. This economic vulnerability, it can push young people into high-risk situations, maybe transactional sex, just to survive. It increases their exposure risk dramatically.
So you really see how these cultural norms, the geographical hurdles, the economic realities, they aren't separate from the health crisis. They're all tangled up together.
Deeply intertwined. Addressing this isn't just about pills and clinics. It's about tackling these deep-rooted social and economic factors.
Okay, but
Yeah.
it's not all grim news, is it? The sources do talk about efforts being made, some glimmers of hope.
Yes, definitely. There are significant efforts from both the government and community organizations that are worth highlighting.
What's the big one on the policy front?
Well, the Philippine HIV and AIDS Policy Act of 2018, that's RA 11166, it's seen as a landmark piece of legislation.
How did it change things?
It really expanded access to testing. Crucially, it allowed minors aged 15 to 17 to get tested without parental consent. That was huge. And it's helped make ART-T and Pre-P more available.
Okay, so policy changes. What about the DOH, clinically?
They've rolled out some key initiatives, like shifting to dilute graver-based RT as the preferred first-line treatment. That's a more effective, often better tolerated regimen.
Right.
And they've also moved towards a decentralized rapid HIV diagnostic algorithm, basically helping speed up diagnosis closer to where people actually live.
And community groups, you mentioned their role.
Absolutely vital. They're often on the front lines, offering confidential testing, making self-testing kits available, reaching people who might never walk into a formal clinic because of stigma.
Is technology playing a part?
It is. The sources mention the patient appointment system, or PAS. It allows people to book appointments online for free ART and screening. The idea is to make access easier, maybe less intimidating.
What about awareness campaigns? Are those happening?
Yes. The DOH promotes what they call the combination prevention method, condoms, lubricants, PEP. They're using social media and highlighting specific clinics known for being welcoming.
Like that clinic at Eastwood in Manila.
Exactly. Noted in the sources for fostering a stigma-free environment for testing and treatment. That's so important.
Is there enough money being put towards this funding?
Well, the HIV program budget did get an increase for 2025, which is positive, but the sources also include experts saying it's still not enough, given the sheer scale and growth of the epidemic.
Right. And what about reaching those rural areas?
There's a push for community outreach, including using mobile clinics to try and bridge those geographical gaps we talked about, bringing services to the people.
Are these efforts making a dent? Is there progress?
There's some, incrementally, particularly in awareness, like knowledge about pre-DP among key populations went up from 8% in 2020 to 13%. That's progress. But uptake is still quite low overall, especially outside the big cities. So translating that awareness into actual behavioral change, into people accessing PPP or consistently using condoms, that's the next big hurdle.
So it sounds like the challenge isn't necessarily a lack of ideas or even policies,
Not entirely, no.
but more about effectively scaling these initiatives up across all those islands and navigating the persistent political and cultural resistance.
Exactly. The groundwork is being laid, you could say. But reaching the sheer number of people at risk and changing those deep-seated issues like stigma, it requires overcoming significant systemic inertia.
Which brings us straight to the need for urgent action. Given how fast this is moving and how complex it all is, the sources collectively sound a really clear alarm bell.
A very loud one. Coordinated action is needed urgently.
So based on everything we've discussed, what are the key action areas?
Well, tackling that deep-seated stigma has to be right at the top. Targeted education. Not just general slogans, but campaigns in schools, in rural communities, directly challenging the myths with facts about how HIV is actually transmitted and prevented.
Makes sense. And healthcare access.
It absolutely must be expanded dramatically, like training primary care doctors in local health centers, especially in rural areas, so they can provide RT and other services.
So people don't have to travel so far.
Exactly. Cut down wait times, improve treatment retention, make it accessible.
What about the economic side?
Providing economic support is crucial too. Maybe targeted job programs for vulnerable youth. Something to reduce those poverty-driven risks that push people into unsafe situations.
And sex education,
Yeah.
even with the pushback.
Yes. Promoting behavioral change through comprehensive, evidence-based sex ed has to be prioritized. Despite the cultural challenges, we need to equip the next generation with the knowledge to protect themselves.
It's striking that the DOH itself is calling for a national public health emergency. That call is echoed in some ex-posts mentioned in the sources.
It really underscores the level of crisis and the need for everyone, government, NGOs, communities, individuals to work together seamlessly.
But the sources do offer some hope that it's not like an inevitable tide, right?
Yeah.
They mentioned some success stories.
Yeah, things like those park and test clinics reaching specific groups like call center workers with accessible, confidential testing. It shows that innovative, localized solutions can work when they're tailored properly.
So it can be done.
It can, but ultimately, the sources strongly suggest that without a really concerted, sustained effort to address those fundamental root causes, that whole web of stigma, access issues, lack of education, poverty, the epidemic is likely to continue on its current path.
With that sobering projection of cases potentially doubling by 2030.
Exactly. The Philippines has many of the policy tools, many of the program ideas are there, but the real challenge now is mobilizing the political will, fostering that broad societal cooperation to implement everything at the scale and speed that's desperately needed. Time is very much of the essence.
It's a truly sobering situation, definitely. But one where, dedicated effort, guided by the kind of information we've seen in these sources, clearly offers pathways forward. So to kind of wrap up this deep dive, the core problem we've really explored is this alarming, unprecedented rise in HIV cases in the Philippines since about 2010.
Yeah, propelled by that complex mix of stigma, limited healthcare access, changing sexual behaviors, often amplified by tech, and those underlying economic pressures.
We've seen the scale of the urgency in the numbers, over 6,700 new cases just in the first few months of 2025.
And that daunting projection, potentially over 400,000 people living with HIV by 2030 if the trend isn't reversed.
And while the sources show genuine hope, progressive policies like RA Level 166, dedicated community work, they also make it really clear that huge challenges remain.
Deeply rooted challenges. Cultural resistance, geography, resource gaps, they're all still very much in play.
So effectively tackling this crisis, turning that tide, it really demands that comprehensive, multifaceted approach we talked about.
Yeah. Sustained, targeted education to fight the myths. Vastly expanded, accessible healthcare across all the islands, economic support to reduce vulnerability, and just bold, unwavering policy to break down those systemic barriers.
Okay, so given all these interconnected factors we've looked at, culture, geography, policy, behavior, here's a final thought maybe for you, our listener, to consider. What single area do you think is the absolute most crucial leverage point? The place to focus first to try and significantly slow down and eventually reverse this rapid increase in HIV cases. Where do you even start when everything seems so connected?
That's a tough question. Gets right to the heart of the strategic challenge, doesn't it?
It does. We hope this deep dive has given you a clearer understanding of the situation in the Philippines and maybe provided some significant points for reflection.